According to the National Institute of Health, an estimated 1/3 of Americans between 65 and 75, and close to half of those older than 75, have some degree of hearing loss. We spoke with Dr. Johnny Arruda at Redlands Community Hospital, who gave us more information on hearing loss.
Typically, as we get older, we start having a high tone loss, but it can be very mild. You can have a little ringing and subtle things. If it's noisy, you can't hear, but otherwise you're fine. Whereas if it's beyond that point where in any situation you're struggling, then you probably should think about a hearing aid. And a hearing test can help sort out the difference and the degree and make sure there's not something more serious going on.
Who's at risk for hearing loss?
A vast majority of us as we get older have the high tone loss. I will occasionally see someone in their 70s with perfect hearing, but that's the exception. So it's important to protect the hearing when you're younger around loud noises, things that we don't always think about too much, like mowing the lawn, or to prevent the more extensive loss when you get older. Another sign of hearing loss is tinnitus, or you can say tinnitus. People will describe it as a ringing or a high-pitched hum, or it could be low pitch. And generally that means there's some degree of hearing loss. Generally the brain will adapt and you can tune it out. In severe cases it can require some help through your physician. There are a variety of things that can be done to help, not necessarily to make it totally go away, but help you deal with it.
And how important is it to have a hearing test done?
A hearing test is extremely important because one of the more common reasons for that is having a hearing loss on one side versus the other. That could be an early sign of a tumor. And not being able to hear with the two ears, and you can't hear in 3 dimensions like you need 2 eyes to see in 3 dimensions. Just a simple high tone loss can present that way, but it's not quite as dramatic. With children, they have speech difficulties frequently. Speech delay, it can be subtle. That's why it's very important to check children and catch it early to help with speech-language development.
How do most people adapt to a hearing aid?
It depends on your degree of loss. If you have a very severe loss, it opens up the world to you and you just love them. But most of us aren't in that category, and it's annoying to put something that's blocking your ear canal. You can get feedback, irritation from the moisture. There's an adjustment period. Most people are able to adapt. The newer hearing aids have a little more space, allow a little more air. But if you have really bad hearing, for that extra power, it needs to plug your ear canal. There's exciting new technologies today with implantable hearing aids. It's still in evolution. There are some things coming on the market, but it's still not widely available.
What other treatments are available for hearing loss besides a hearing aid?
Treatment for loss of hearing would depend. A sudden sensory neural loss sometimes can respond dramatically to a short course of steroids. A lot of those patients are also placed on vasodilators such as niacin to help stabilize the hearing loss. And then it requires investigation to make sure there's not a tumor or something more serious. Patients with mechanical or conductive type losses, frequently surgery can correct that dramatically. With children, unfortunately, with congenital hearing losses, if it's a sensory neural loss, there's not a lot of options besides hearing aids or possibly a cochlear implant. But again, if it's conductive, a congenital conductive loss, there are various things we can do.